times get hard, and we're here to help at NorthPoint.
Hello, welcome to another episode of NorthPoint Making Health Happen. My name is Lisa Castile, your host for the program. Thank you so much for tuning in today. This series is being brought to you by NorthPoint Health and Wellness Center. We want to connect you with topics in health and wellness that impact our community, and we want to provide you with practical tips and resources you can use. Today, we will be discussing breast health with one of our providers, Lisa Jonas, who is the Radiology Supervisor here at NorthPoint Health and Wellness Center. A little bit about Lisa. Lisa has always been passionate about providing quality mammography screening that is accessible to all women of all socioeconomic status. After working at multiple facilities throughout the U.S., she made her home in Minneapolis and has been an integral member of the NorthPoint Health and Wellness team for the past 16 years. Lisa refers to herself as a radiologic science geek. She enjoys collaborating with the Minnesota Department of Health, American Cancer Society, and several other outside agencies on community outreach programs to provide free well woman exams, breast imaging, and breast health education to women in the Twin Cities. We are so excited to have you with us today.
Thank you so much, Lisa.
Yes.
I'm very happy to be here, and I appreciate the opportunity.
Absolutely. And you had such an impressive bio. Is there anything else that you would like to share with us about your background and how you came to do this work, Lisa?
Strangely, I fell right into it. I had went to school to be a radiology technologist. I was a single mom at the time, and I was like, how am I going to support this small child on my own? So I got that degree. Then I got the advanced degree in mammography, and I went right from there to the University of North Carolina, Chapel Hill, where I worked specifically in breast cancer research programs, and was very instrumental in getting digital mammography passed by the FDA.
Wow.
Which is what we use today, and it's even advanced further to 3D tomosynthesis, which we have here at NorthPoint.
Amazing.
Yeah.
Oh my goodness, you're a forerunner in your field. I love that. All right. Well, so tell us, what are some common myths about breast health that you'd like to debunk right off the bat?
I think the first thing, and I'm going to say it's not so much a myth as I'm going to say it's a misconception. What I hear from a lot of women is they will say, I don't need a mammogram. Nobody in my family has breast cancer. There's nothing wrong with my breasts. And that is a huge misconception. The whole reason why we recommend doing screening mammograms every 1 to 2 years is we're looking for things in the breast that are so small you can't feel them with your fingers. Your healthcare provider can't feel them. You can't feel them. And we know that 85% of people who get diagnosed with breast cancer have no family history at all.
Wow.
Yeah. Our two greatest risk factors for developing breast cancer are just being born female and aging. So we know as we get older, our risk increases.
Okay, very good to know. And then we do some engagement here at NorthPoint around health screenings, breast health. Can you talk a little bit about that and share?
Well, Lisa, yes, we actually have multiple things that we do, and most of the things that we do are year-round. Obviously, we work very, very closely with our healthcare providers who talk to all of their patients, about what their risk factors are. If they're due for their mammogram, they encourage them to get those done. We also have a lot of education on site about the importance of doing your screening mammograms, having that relationship with your healthcare provider, to speak with them if you do notice a problem. We also collaborate with our Human Services Agency, and so a lot of times if they're doing outreach, whether that's here on site at NorthPoint, for instance, Fresh Food Fridays, they may have some information out there with breast cancer education and the services that we provide here. It just happens to be the month of October, so we are doing a couple of special things, such as giving out some gift bags and providing some extra education around the importance of breast health awareness.
Great, wonderful. So let's talk a little bit about when we first were chatting before we went on. We talked about age and that being a factor in breast health. Can you share a little bit more about that? Because I'm at that age where I'm a little starting to get concerned about some of these things.
Yes, I think there has been a lot of confusion within the media with different organizations and their recommendations about when to start screening mammograms. This is actually the first year that everyone has been on the same page. The United States Preventative Task Force just recently changed their recommendations and are now in agreement with the American College of Radiology, Society of Breast Imaging, oncologists, that all women of average risk should begin screening at the age of 40, every 1 to 2 years. This is why it's so important to speak with your healthcare provider about what your personal risk factors are. Some people are at higher risk. Maybe they had a first-degree relative who was diagnosed at age 42 with breast cancer. In that circumstance, they might recommend that you start before age 40. So it's very, very important to have that relationship with a primary care healthcare provider.
Okay. Wonderful. Yes, that is very good to know. We talked about family history. So how much family history is it important for your provider to know when you're coming in for a screening? What are you sharing about?
Well, the provider is going to take in a lot of information, maybe about things that don't necessarily deal with breasts specifically. The two things when we're looking at your risk for breast factor are first-degree relatives. So a first-degree relative is defined as a parent, a sibling, or a child that may have been diagnosed with breast cancer. And then the secondary is if you've had any first-degree relative diagnosed with ovarian cancer. Both of these deal more with our hormones, so that's why they include the ovarian cancer with a risk factor for breast cancer.
Okay, wonderful. And are there some things that you can do at home as well, like self-breast checks? What are some healthy diet?
Yeah.
What are some of the things that you can help to reduce the risk? And
so, talking about checking your own breasts, it used to be, I've been in this for a very long time. I'm going on close to 30 years of being in women's breast health. And we used to always encourage women to do a self-breast exam. If you're still menstruating, about 7 to 10 days after your period. If you're not menstruating anymore, postmenopausal, or on some sort of birth control where you don't menstruate anymore, just pick a day of the month, maybe the day you were born. So if you were born on the 15th, I'm just going to do it on the 15th of every month. We don't really give instructions anymore on how to do a self-breast exam. So I guess one of the most important things is that people tend to think that the breast tissue is just right here. But really, our breast tissue starts right below the clavicle, goes all the way down the middle of your sternum, all the way underneath, along the side where your ribs are, and all the way up into your underarm area. So when you're checking, this is all breast tissue up here. When you're checking, we recommend that you use the soft pads of these 3 fingers. They're the most sensitive. I like to steal Nike's slogan, just do it. Just do it.
Yeah.
Don't worry about being perfect. The point is you get to know how your breasts normally look and feel. So I always advocate examining in the mirror as well. Sometimes you'll see something in the mirror and you'll be like, oh, is that like a little lump there? So look in the mirror and also feel. I like to go in little circles. You can do it laying down in your bed while you're watching TV, while you're in the shower. Just pick what works best for you.
Okay, wonderful. Yeah, this is all part of our health and wellness.
Yes.
Once per month.
Yes.
Okay.
Yes.
Okay.
Yep. And I hear a lot from women. They're like, oh, everything feels lumpy to me. I would never notice. But the point is, you do get used to how they feel, and you will notice if something has changed.
Sure.
And then you'll want to make an appointment with your healthcare provider as soon as possible, to have that evaluated.
Wonderful. Thank you
Yes.
so much, Lisa. Are there any physical or warning signs that you mentioned the lumps, but anything else?
Yes. Some of the things that we get concerned about is if you have swelling, redness, develop a rash specifically around the areola nipple area, pain in one specific area that doesn't go away within like 3 weeks. If it doesn't resolve on its own, you want to come in and get checked. Nipple discharge, especially if it's clear, like there's hardly any color to it at all, and then brown or bloody. And we call these spontaneous nipple discharge, meaning you didn't squeeze your nipple. And we highly discourage squeezing your nipple. Please don't do that. It's not good for you. So spontaneous means maybe you woke up in the morning and it was on your nightshirt, or you took your bra off and you noticed something in your bra, or it's just like, oh, why is my nipple wet? So if you notice anything like that, see your healthcare provider right away.
Wonderful. Thank you. I also want to talk about resources for our Black and brown populations. You had mentioned that there are some support groups or specific resources for those guests.
Yes.
Okay.
And I think for Black women, and we don't necessarily know why, but I think it is important to note that white women are actually more likely to get diagnosed with breast cancer, but Black women are actually more likely to die from breast cancer. Breast cancer caught early through a screening mammogram is 99.9% survivable. Because we're catching things so small, sometimes even as small as 1 millimeter, that needs hardly any treatment. A lot of times it's just what we call a lumpectomy, so a surgery just to remove that small area, and then maybe some radiation therapy. I can't speak 100% on what the treatment will be. I am not an oncologist, so just kind of some general. Everybody's case is different. How breast cancer is treated these days, it's not a one-size-fits-all. It's very tailored to the pathology that comes back.
Sure. And I know, so some folks have reservations about going to the doctor anyways, but I know, there's this stigma associated with the actual exam itself. Can you talk a little bit about that? Maybe make people feel better about when they come in. You kind of just need to, like you said, just do it, right?
Yeah, exactly. So we can kind of go back to the myth a little bit about mammograms. I think there's, mammograms get a really bad rap.
They do.
A lot of people say, oh my God, it's so painful. They're going to smash my breast. We do put compression on the breast. This is true. However, a mammogram should not be painful. Yes, you'll feel a little bit of pressure on the breast. It might be a little bit uncomfortable, but really you're only under compression for about 15 or 20 seconds. And then that compression pedal, it automatically releases off the breast. Now, the whole reason that we have to do that compression is we have a lot of different tissue inside our breasts. We have ducts, we have lobules, we have fatty tissue, fibroglandular tissue, Cooper's ligaments. There's all kinds of anatomy in there. Well, in order to see through all that breast tissue, the compression helps even it out so that the radiologist can get a good reading. And it also stops motion. So if you're holding really still, we get a really good image. If there's motion on the picture, it's too blurry to read. So it serves two purposes.
Okay.
Yeah.
Well, that's really interesting. That's
Yeah.
good to know. I've been through some mammograms myself, and I think before going, I had all this apprehension because I thought, oh, this is going to be so horrible. It's going to be so painful. And once I got in there, I was like, oh my goodness.
Yes,
Yeah.
and if it's your first time or you've never had a mammogram before, the technologists are really great at about explaining everything that they're going to do before they start, answer any questions that you have. And I do say, while you're being positioned, if it really does feel painful, let your technologist know right away. she'll reposition to make it so it's not so uncomfortable. And then can I just round back on some other resources for Black women?
Please.
So for Black women, one of my favorite resources is from Susan G. Komen, and it's called Know Your Girls. And it's all focused on Black women. There's quizzes on there that you can take about what your possible risk factors might be. There's a plethora of videos. Everywhere from, what my first experience was like having a screening mammogram to breast cancer survivors. It's one of my favorites.
Thank you for that resource. I also want to ask you, are there any resources or any thing that our transgender community needs to be aware of as it relates to breast health?
Yes. I do have to say that I feel like it's taken a really long time for the research to catch up with our transgender population. I'm just going to kind of brush on the important points. So for transgender, so if you were born female, even if you don't identify as female anymore, but you still have breast tissue, you should be getting your mammograms just as an average risk woman would be. And you should also be talking to your healthcare provider, because what if you are high risk as well, with a first degree family member with breast cancer. So identify as female, born, or identify as male, born female, and you still have breast tissue, you should still be getting mammograms. Now, for transgender born male, identifying as a female, and if you are taking all these hormones to transition, you may need to be getting mammograms as well. It's really, really important to talk to your healthcare provider about that. We do have some resources specifically for the transgender population that I can share after this, at the end of this video.
Great. Thank you so
interview.
much. Yeah, that's great. All right. Tell us about SAGE, Lisa. What is that?
Okay. So here at NorthPoint, we partner with the Minnesota Department of Health SAGE program. The SAGE program is a breast and cervical cancer control program that provides free well-woman exams so that you can see a healthcare provider and get a free mammogram and also a free pap smear for cervical cancer if you're due for that as well. There are some guidelines for that. It's specifically for people who are uninsured, have no insurance, or are underinsured, so that they can take advantage of helping to have their screenings paid for. So in the uninsured population, it's 100%. In the underinsured, we bill your insurance company first, and then the SAGE program will pick up anything that your insurance did not cover. So for the SAGE program, what you would want to do is you would want to call, make an appointment with one of the healthcare providers. During that appointment, they will do a breast exam. They will also talk to you about what all of your risk factors are. If you're due for a pap smear, they'll perform the pap smear at that time as well. And we do try to schedule your screening mammogram for the same day. So then after that appointment, you could come down and have your mammogram done. If for some reason the schedule's full, we can just schedule you for a future appointment to have that.
I love that. Yeah, so let's talk about, because we have a lot of in-house resources, right? We have this wonderful facility with so many different services. So talk a little bit about that. When you come in, you're new to NorthPoint. Can you walk us through that experience a little bit?
So if you're a new patient and you've never been to NorthPoint before, it starts with a phone call. You can also walk in as well, but usually it starts with a phone call, getting an appointment scheduled. From there, when you arrive for your appointment, you check in at our front desk, and they will go over our financial resources. So on top of the SAGE program that we work with, for free well woman exams. We also have a NorthPoint slide fee for uninsured patients as well. They'll also help you apply for insurance, see if you qualify for medical insurance. If you don't, then the slide fee. From there, you will go to see the provider. You'll have your visit with the provider, and they will put in referrals or order any tests, blood tests. We have a full lab here at NorthPoint as well. So we are a fully functioning medical clinic.
Wonderful.
Yeah, we have our own pharmacy and eye clinic, behavioral health. We offer a lot here. And like I said, our human services agency, we have so many resources through them. So if you're struggling with being able to afford food, our food shelf, maybe job, housing.
All of that.
Yes.
Yeah.
I mean, I feel anyway that we're very amazing.
We are amazing here at NorthPoint. You're amazing. Well, let's talk a little bit about healthy diet, right? Because we know that having a healthy diet is important. And I know sometimes access to healthy food can be a barrier, so we have some resources. So let's talk about healthy diet and the resources that we have available at NorthPoint.
Yes. So I've already mentioned our food shelf. I think it's the way that it's set up is, to me, it's almost like it's a grocery store. You have your shopping cart, you go in, you pick out your food. We do advocate for a healthy diet because we know that those high processed foods are not good for us. So we do offer fresh fruits and vegetables and lean proteins. We know how hard it is to have a healthy diet. Our lives are very busy. We're pulled in a lot of directions. And I know going for that fast food is so much easier. But we actually have a nutritionist on site as well. And we do some cooking classes to show you how to do some easy breezy healthy meals. I'm a big fan of meal in a pot at my house because I'm a lazy cook.
Okay.
So I'm a big fan of soup.
I love it. So those are those one-pot meals, right?
One-pot meals. Okay. I'm all about the one-pot meal.
Great.
Yes.
Great.
Yes.
Wonderful. Yeah, those are some great resources. Thank you for reminding our audience about those. All right. All right. So, Lisa, I would love for you to tell us, how does NorthPoint respond to our community's needs? People with different backgrounds. Are there some things that we do uniquely here at NorthPoint?
Yes. We have on-site interpreters. So for persons where English is maybe not their first language, we do partner with a lot of language interpreter services. So we do have on-site interpreters. We have what we call video remote interpreters, where we have an iPad where we can get an interpreter on pretty much any language you can think of. We can provide that for you during your visit, on the phone when you call to schedule an appointment, during any exams that you're having done. And then because we have such a diverse workforce, we have a lot of people who are employed at NorthPoint who are probably from that same cultural background. So you have the opportunity to meet with someone that understands where you're coming from.
Sure. Lisa, thank you so much for being on the program with us today. We really appreciate your time.
Oh my gosh, you're so welcome. And I appreciate, like I said, the opportunity to be here and talk about breast health. I think it's so important, and to, like I said, be aware of how your breasts normally look and feel. Get your screening mammograms starting at age 40 every 1 to 2 years, and see your healthcare provider if you notice any changes or have any concerns about your breasts.
Wonderful. Thank you for listening to this week's Making Health Happen. We want you to know that we're here to partner with you and to help make health happen in your life. To learn more about NorthPoint, call us at 612-543-2500 or visit us on the web at northpointhealth.org.